November is National Diabetes Month, Aaron, making this a good time to talk about the connection between diabetes and kidney disease. Dr. Lauren McDonald, a nephrologist with Dallas Nephrology Associates, is here to explain how diabetes affects kidney health and ways to keep your kidneys healthy. Good morning. So glad to have you in the studio.
Good morning.
So first of all, can you just start by reminding us exactly what is diabetes?
Well, I'm going to make it really simple because I think it's important. This is such a terrible disease. People need to understand. Diabetes is an elevated blood sugar or glucose caused by the fact that we have an organ called the pancreas, which secretes a hormone called insulin. Insulin helps us metabolize a lot of our food, our carbohydrates, and so therefore brings our blood sugars back to normal. When you don't make enough insulin, you have something called diabetes, causing the elevated blood sugar.
Okay, I love that explanation because we hear it all the time, but it's such a good explanation. So how do you know if you have diabetes and or kidney disease?
Well, just starting with the diagnosis of diabetes, a lot of times people will feel tired, very thirsty. They may note that they're urinating a lot. They may be losing weight. You go to the doctor and your blood sugar is elevated, and you're diagnosed with diabetes. And there's some variation there, but for the most part, a blood sugar greater than 100 consistently is diabetes. As you go on in the disease, we do something called hemoglobin A1C. What that means is, and this is a relatively new test in the last 20 years, is that the blood sugar is connected to the blood cells, and we're able to see what your blood sugar management has been for the previous 4 to 6 weeks. So, you know, a lot of times people will go to the doctor a day before, they'll be really good, everything looks good, but this kind of tells us what's been going on for quite a while.
So here's what I'm curious about. How are diabetes and kidney disease related?
Excellent question. Diabetes is the #1 cause of kidney disease in this country. And what happens is that elevated blood sugar over years can cause damage to the blood vessels, therefore causing stroke, heart attack, damage to the blood vessels of our toes and fingers leading to gangrene, which can cause amputations, also causing heart disease and changes in the kidneys, causing protein loss in the urine and inability of the kidneys to clear poisons from the body.
So can damage to the kidneys be reversed?
Generally not from diabetes. No, there's some provocative studies, but in this day and age, once you have diabetic kidney disease, there's nothing that we can do to reverse it. We can try different medicines to keep it stable, to forestall any further changes. We recommend that people stay as close as possible to their ideal body weight, that they control their blood sugars. Blood pressure control is also very important.
So ways to take, that's the last thing I want to ask you before you get away. What are ways to take better care of yourself? You just mentioned a couple. If you have both diabetes and kidney disease.
Well, we always say know your numbers. So when you go to the doctor, know what your blood pressure is. And there are certain goals. 120 to 130 over 60 to 70 is ideal. Know something called the creatinine, which is a blood test, which is a marker of kidney function. Normal for ladies is 1 or less, for men 1.2 or less. Know what that number is. If it's elevated, there's a problem. Know how much protein you're spilling in your kidneys. Protein spillage is indicative of damage from diabetes causing kidney disease. Also, know your family history. If mom and dad or other first-degree relatives have diabetic kidney disease, there's a good chance that you could also develop this.
Thank you so much. I learned a whole lot just now, just in the last 4 minutes. Thank you so much. Appreciate it. Good information. Dallas Nephrology Associates has been treating kidney patients for more than 50 years and has more than 100 healthcare providers and 38 area locations. Here's the number to call, 214-358-2300 or 877-654-3639 for more information, or go to dneph.com.